discussion on canine heartworm disease management. Today we're going to focus on one of the most debated topics in heartworm therapy, whether the American Heartworm Society 3-injection protocol for melarsomin is significantly safer and more effective than the original FDA-approved 2-injection protocol for dogs with Class 1 and Class 2 disease. Before we dive into comparing the protocols, it's helpful to briefly review the biology of the parasite and why treatment must be handled carefully. Heartworm disease is caused by the parasite Dirofilaria amidis. Adult worms reside primarily within the pulmonary arteries of infected dogs. Although in heavy infections they may extend into the right ventricle and vena cava, these worms can live for several years, and during that time they continuously irritate the vascular lining of the pulmonary arteries. That irritation stimulates inflammation, fibrosis, and narrowing of the vessels. Over time, the resultant vascular damage increases resistance to blood flow through the lungs. This can lead to pulmonary hypertension and eventually right-sided heart strain. Even dogs that appear clinically normal, these pathological processes may already be occurring. So when we treat heartworm injections, we are not just removing parasites, we are also trying to halt the disease progression while avoiding complications that are associated with killing large worms inside delicate pulmonary vessels. With that context in mind, let's begin by discussing the difference between the two adulticide protocols.
That was a good introduction, thank you. The traditional FDA-approved protocol involves administering 2 injections of melarsomin 24 hours apart. This regimen has been used for decades and historically showed very high success rates in dogs with relatively mild infections. Studies conducted during early drug approval trials suggested that approximately 96% of infections were successfully cleared using this method. Melarsomin works by disrupting parasite metabolism and damaging tissues of adult worms, leading to their death. Once the worms die, they begin to deteriorate and are gradually broken down by the dog's immune system and pulmonary circulation. However, that process is not always completely smooth. As dead worms fragments, they can travel through the pulmonary arteries and temporarily obstruct blood flow in portions of the lung.
And that complication is what led researchers to question whether a different dosing strategy might reduce the risk of thromboembolic events. The 3-injection protocol recommended by the American Heartworm Society begins with a single injection of melarsomin. That initial dose kills a portion of adult worms and weakens the remaining parasites. Then, approximately 1 month later, the patient receives 2 additional injections separated by 24 hours. The logic behind this staging is that the first injection reduces the overall worm burden before the final treatment. By the time the last 2 injections are given, there are fewer worms remaining, so the number of worms dying simultaneously is reduced.
These are all really good points, but from a physiological standpoint, that staged approach makes a lot of sense. When multiple worms die at the same time, the fragments can cause a pulmonary thromboembolism. That condition occurs when worm debris blocks blood vessels within the lungs. So these dogs are going to have coughing and fever and difficulty breathing, and there can even be a collapse in the obstruction if it's severe. By spacing out the treatment, the 3-dose protocol essentially spreads the parasitic death over time. So the body has more opportunity to clear the worm fragments gradually instead of dealing with a large amount of debris all at once.
That makes a lot of sense. Another point that often comes up in the literature is overall worm clearance. Several experimental studies compared the number of worms remaining after treatment using biopsy data. In those studies, dogs treated with a 3-dose regimen consistently had fewer surviving worms than dogs treated with the traditional 2-dose regimen. Additionally, antigen testing following treatment tends to become negative more frequently in dogs treated with a 3-dose protocol. Since antigen tests detect proteins produced by adult female worms, conversion to negative status strongly suggests successful elimination of adult parasites.
That raises an interesting question about clinical outcomes. If both protocols are effective, does the additional injection significantly change how patients recover? What has been observed in everyday veterinarian practices?
Those are some good questions. Many clinicians report that dogs treated with the 3-dose protocol appear to tolerate treatment somewhat better, particularly when the worm burden is moderate or uncertain. Because some worms are eliminated during the first injection, the body is already beginning to clear the debris before the final 2 injections are administered. This gradual reduction in parasite load may reduce the severity of inflammation responses and pulmonary complications following treatment.
Yes. However, it's also important to recognize that both protocols still carry some risk. Even with staged therapy, dead worms must eventually be cleared from the pulmonary circulation. That's why strict exercise restriction is such a critical part of heartworm treatment. Dogs are usually confined to leash walks only for several weeks during and after adult-decided therapy.
Yeah, so piggybacking off of that, we all know that exercise is going to increase your heart rate and your pulmonary blood flow. So if a dog becomes overly active while those worms are breaking down, then the increased circulation can dislodge those fragments more quickly and increase the chance of embolic complications.
So when we combine all these factors, worm clearance rates, necropsy findings, clinical observations, and complication risks, it becomes a lot easier to see why the American Heartworm Society eventually recommended the 3-injection protocol for most dogs, regardless of their heartworm disease class.
Well, I think this was a good discussion. This seems like a good place to wrap up the first section. To summarize, both protocols are capable of clearing infection, but the 3-dose approach appears to improve overall parasite elimination and may reduce the likelihood of severe post-treatment complications. That evidence forms the basis for current clinical guidelines recommending the 3-injection protocol as the preferred adulticide treatment.
All right, that was a good conclusion. Join us back in our next podcast for discussion 2, where we will discuss evaluating slow kill therapy.
All right, everyone, welcome back to discussion 2 on evaluating slow kill therapy for heartworm. So, we already discussed adulticide protocols. Let's transition into another topic that has generated considerable debate in veterinary medicine, the so-called slow kill approach to heartworm treatment. Slow kill therapy typically involves administering monthly macrocyclic lactone prevention medications, sometimes combined with doxycycline in an attempt to gradually eliminate adult worms over time. Some veterinarians have advocated this method as more affordable alternative for clients who cannot afford melarsomin treatment, but the approach is controversial for several reasons.
Yeah, the primary advantage of slow kill therapy is cost. Adulticide therapy can be expensive and often requires multiple veterinary visits for diagnostic injections and follow-up monitoring. For some clients, those costs can be a major barrier. Because macrocyclic lactones preventatives are relatively inexpensive and widely available, some owners find slow kill therapy financially more manageable.
And research has found that in some cases, adult worms may eventually die when dogs receive monthly ivermectin over extended periods of time. Certain studies reported elimination rates approaching 95% after nearly 2.5 years of continuous treatment. However, the key phrase there is extended period of time. Those worms remain alive inside the pulmonary arteries for months or even years while the treatment is taking place.
Right, and during that time, the disease process continues. Adult worms continue damaging those pulmonary arteries, causing inflammation, fibrosis, and increased vascular resistance. Even if the worms eventually die, the cardiopulmonary damage that occurred during that time may be irreversible.
Another concern involves the development of drug resistance, everyone's favorite topic. Macrocyclic lactones are extremely important medications because they are the primary drugs used for heartworm prevention worldwide. If worms are exposed to subtherapeutic drug levels for prolonged periods, selective pressure may allow resistant strains of the parasite to emerge.
And that possibility has serious implications. If macrocyclic lactones resistance become widespread, preventative medication that millions of dogs rely on every year could be less effective.
Exactly. That's why so many professional organizations, including the American Heartworm Society and Companion
Right, no, you're making a good point.
and
You're making a good
Companion
point.
Animal Parasite
Yes.
Council do not recommend slow kill therapy as routine treatment option.
Yeah, that being said, there may still be rare situations where slow kill therapy is considered. For example, some dogs may have severe concurrent diseases that make adulticide therapy too risky. Others may belong to owners who truly cannot afford the recommended treatment.
Right, so let's circle back to that. In those situations, veterinarians must carefully explain the risks and limitations of that slow kill therapy. So monitoring through regular antigen testing and clinical evaluation is essential. to ensure the patient's condition does not deteriorate.
Okay, so overall, the consensus among our panel seems to be that slow kill therapy should not replace adulticidal treatment in most cases. While it may provide an alternative in special circumstances, Muller-Simon remains the gold standard for eliminating adult heartworms.
All right, so if you enjoyed the podcast today, please join us for discussion 3, where we'll have a real-life veterinarian scenario.
Hit the subscription!
Our discussion across both our two roundtables was based on several key studies, including Robach and Patton 2013, McTire et al. At 1994, and Caratone et al. At 2014, as well as research on slow kill approaches such as McGall 2005 and Yoon et al. 2017.
These sources helped guide our evaluation of treatment safety, efficacy, and clinical decision making.
Studies show that melarsoline treatment eliminates approximately 90 to 98% of adult heartworms, with the 3-dose protocol improving overall worm clearance while reducing complications compared to the 2-dose protocol.
In contrast, slow kill approaches may take 1 to 2 years to eliminate worms, during which time ongoing vascular damage can occur.
To better illustrate how this information is applied in practice, we will now demonstrate a clinical scenario using the staged treatment approach.
Did you guys check in yet?
Oh, no, sorry.
Perfect. Who do we have today? Oh, you're cute. Yeah.
This is Totino Pizza Roll.
I love it.
We just call him Tino for short.
Oh, perfect. Are you guys here for that 10 o'clock appointment?
Yes.
All right, perfect. If you want to just step through that doorway over there and find a seat in the waiting room, okay?
Thank you.
Perfect.
Hi, Tino.
All right, guys, we're ready for you here in exam room 1.
Thank
Perfect.
you.
If you guys want to take a seat. Perfect. And this is student intern Elliot. He's going to ask you just a couple questions about Tino today.
How are you guys doing today?
Good. How are you?
Doing good. Would you guys care to just come over to the exam table 1 for us?
Come on, buddy.
Alrighty, so how is Tino doing?
He's been a little off recently.
Okay, what do you mean?
How would you describe it?
He's not as active as he used to be. He's only 3, so he used to like run around, he would play fetch all the time, but
Yeah.
every time he exercises now, he kind of is just like coughing, he gets out of
Okay.
breath really easily.
Yeah, he doesn't
Um,
even eat his like Little Caesars anymore.
Yeah.
Oh, no.
And he's kind of just been laying around,
Yeah.
which like not normal for a 3-year-old
Mm-mm.
dog, so I don't.
Okay, and how long has this been going on for?
You know, I feel like, what would you say? He's been weird for like a few weeks now.
Yeah.
Okay. And what kind of prevention have you guys been on? Are you guys on the heartworm flea tick prevention?
Okay, so, we were like a
Okay.
while ago, but I don't know, he never really got anything, and so we were thinking, like, we live in the city,
Yeah.
and so
Oh, okay.
we're just like, we'll probably take him off of that for a little bit, but he never gets into anything, so.
Okay, well, we're gonna go talk to the vet kind of about everything we went over today. We're gonna get a quick temperature when the vet comes back in. And do you care if we possibly get some blood samples?
No, yeah, that'll be
from Tino?
fine.
Okay, sounds good.
All right, perfect. Well, we'll go ahead and let the vet know she's ready to come on in if you guys want to take a seat, okay?
Thank you.
Perfect.
Thank you.
Do you think he'll need to be muzzled? He's doing good today.
I know.
I wonder, you don't think he ate another sock, do you?
I don't know. He does get socks often.
Hi guys, so here we have Tino, I believe.
Yes, our little guy.
Well, sorry to tell you guys this, we have some bad news. Tino's heartworm test came back positive. And right now I have the intern Elliot running the microfilaria test to see if any larvae are present in his blood. But as of now, we do believe there might be at least one female heartworm in him. There could be more depending on how serious the stage is. And it's based on his symptoms and also the fact that you don't have him on any preventatives. It's likely that this positive is a true positive.
I'm sorry, I'm really shocked because, I mean, I didn't think he seemed all that sick, you know? How serious is this?
So I completely understand why this would be upsetting news, but the good news is this is detected early, which allows us to treat before the disease becomes severe, all right? So heartworm infection occurs when a mosquito carrying infected larvae bites a dog. Those larvae enter the bloodstream and gradually mature into adult worms over several months. So that's why you probably didn't see symptoms till now. And because the worms grow slowly, many dogs show no symptoms, like the early stages, and now we're starting to see symptoms because the worms mature and they're in his heart.
Mm-hmm. So as those worms mature, they begin living in the pulmonary arteries near the heart. And basically what happens is over time, they just irritate those blood vessels and they'll interfere with the normal blood flow between the heart and the lungs.
I'm so sorry guys, let me go grab my test.
So what would happen if we didn't treat it?
Alright, you're needed on the phone real
Oh,
quick,
perfect.
I'll take over.
Okay, thank you.
Okay, and we did run the official test, the microfilaria test to see if, Tino is positive, and the results are positive, unfortunately.
All right, guys, so I'm really happy that you want the best for Tino here, and we're gonna do the best treatment. So what this treatment entails is a 3 injection protocol. Now, so day 1, all we're gonna give him is we're gonna start him on preventatives again, and then we are also gonna give him doxycycline, which is just to help with inflammation. All right, and then on day 60, you guys are gonna come back in and we're gonna give that first adulticidal injection. And then you guys are gonna have to come back in again on day 90 and 91. 90 we give first injection, 24 hours we give the second injection. Do you guys have any questions for me?
So earlier you said that we needed to restrict his exercise and leash walk him. Why is that important?
Yeah, I can answer this. So, we have a huge risk when we have exercise while being on medication because we can form a pulmonary thromboembolism, which, in basic terms, it's just a clot that can form and it causes blockages, which can influence tissue damage and even hurt our organs.
All right, and so if you guys have any more questions, we are here, you can call, and hopefully we can answer anything. If not, you guys are good to go to reception, and we'll go get those preventatives and that treatment medication for you guys for today, okay?
Okay, thank you.
You're welcome, thank you guys.